have an amazing guest here tonight, and I'm very grateful that you are here as well, Don Marks. Dr. Don Marks. I arguably, maybe not that arguably, I think one of the best neurologists on the South Shore of Massachusetts.
Wow.
So, yep.
That's a big statement.
No, but it's true. So, welcome, Dr. Marks.
It's nice to be here, Dr. Joe. And Mark, I have to say that the PanMass Challenge is about writing for the disease cancer, and Alzheimer's disease, which I'm going to be speaking about, is the cancer of the 21st century. And because it's older people, we don't ride, we just have Alzheimer's walks.
Yeah.
But it has more or less the same goal. And
the cancer of the 21st century.
Yeah, I mean that
really
insofar as
interesting.
cancer was one of those things which people didn't want to talk about because there wasn't much you could do about it 20, 30, 40 years ago. And so if you can't do something about something that's deadly, maybe we don't want to talk about it. Once it became treatable, it's a very different story. I remember when I was young, I'm 69 now, I remember my father died of cancer at age 42 in 1968. There wasn't much that could be done. A little bit of cobalt treatment, that was it. So it was at the time, we don't talk about it. Now we do talk about it. I'm hoping that the same thing will happen with Alzheimer's disease. I think we're already well on our way. And that's part of what I wanted to get on the radio about. For the last 25 years or so, I've been telling my colleagues as well as patients that we really need to move forward about the diagnosis of this disease. And one of the pushbacks was, well, okay, but what can we do about it? We had some medications, still do, that help treat the symptoms to some degree. Sort of like if you had polio and your knee buckled and we gave you a knee brace, you could walk a little better. It wouldn't do much for the polio. And at this point, we've been waiting and waiting and waiting and waiting and waiting for a drug that might have some true disease modification effects, meaning it changes the course of the disease, much as chemotherapy and other treatments might alter the course of cancer, not just treat the symptoms. So, about June 7th, there was an announcement that the first drug was approved by the FDA for altering the course of Alzheimer's disease. This is after a very, very stormy course. And actually, the stormy course up to that point looks tame compared to the storm that's ensued. The problem is that the drug was approved in a very odd way. It's called aducanumab. It's manufactured by Biogen out of Cambridge, and it was approved for the management of Alzheimer's disease, all Alzheimer's disease. The clinical trial, the studies that were the basis for it being approved, were not done in all people with Alzheimer's, but just people with very mild forms of the disease. So a couple weeks later, they decided, oops, maybe we better walk it back. And they changed the indication to just those people with early disease. Now, in addition, going back to the cancer analogy, which I'm sort of glad that it had the segue it did, because It's very apropos. The FDA decided 25 years ago or so that when you have a tumor, that most tumors express proteins on their surface which get discharged into the blood, and that you could measure the amount of tumor indirectly by measuring the amount of these proteins in your blood, called a biomarker, as opposed to measuring the tumor itself. The idea being, if you wait a few years for the clinical trial to be done, a lot of people will have died in the interim. Right. So the idea is, how do you get it out faster, but intelligently and meaningfully? So what they decided was to use biomarker changes as the basis for approval of cancer drugs. Fast forward 25 years. Now they decide with Alzheimer's they're going to do the same thing. There's a protein called beta amyloid that builds up in abnormal quantities in the brains of people who are destined to have or already have Alzheimer's disease. And the idea was, if you could give an antibody, these engineered monoclonal antibodies, that would pull out the amyloid, that hopefully that would alter the clinical state of the patient. In other words, their mind would be better or at least get worse less quickly.
Yeah.
So what happened is that these drugs, this class of drugs, does get rid of the amyloid, the beta amyloid, very nicely. But the clinical trials upon which the approval was based, unfortunately did not demonstrate as robust a clinical response, meaning that it gets rid of the biomarker, if you will, but did it have an actual effect for patients' well-being? And the answer to that is murkier. And so there's been a firestorm of those of us involved. I was involved in the drug trial for the drug, still are in a follow-up trial. But the question is, was it good enough to have approved? In addition, it's $56,000 a year.
Wow.
The Alzheimer's Association had gun for it being approved. They were not happy about the price. And so there's a lot of discussion. And for me, as someone who's involved in clinical research since the 1990s, one of the more chilling aspects is if you have a bunt single, do you end it there? And so if people say, well, we have nothing, it's better than nothing. You know, I had a second cousin who died of leukemia when she was 10. I was 12 at the time.
Oh,